Good day. Now I'm going to be assessing the abdomen. So abdominal assessment is a evaluation of abdomen, liver, and bladder involving four methods of examination, which is inspection, auscultation, palpation, and percussion. So the main objective is to obtain an accurate nursing health history of the client's abdomen and related functions, and to determine for any deviation of abnormalities of the abdomen. And lastly, to be able to formulate nursing diagnosis, collaborative problem, and referral. So for the preparation, we need to assemble the equipment, which is the examining light, tape measure, water-soluble skin marking pencil, and then the stethoscope. Then, you should introduce yourself and verify the client's identity and explain to the client what you're going to do, why is it necessary, and how the client can cooperate. Then, perform hand hygiene and observe other appropriate infection control procedures. So let us assume that I have my gloves on pair because it was ripped by somebody here. Then, provide for... Then provide for client's privacy. Then determine for the client's history of then you need to determine the client's history of incidents of abdominal pain, its location, onset, sequence, and chronology, its quality or description, its frequency, associated and symptoms of bowel habits, incidents of constipation or diarrhea, change of appetite, food intolerance, food indigest in the last 24 hours, and specific signs and symptoms, and previous problems and treatment. Then, assist the client to a supine position with the arms placed comfortably at the sides. Then, place a small pillow underneath the knees. Then, expose the client's abdomen from the chest line to the pubic area. This will reduce the tension of the abdominal muscles and to avoid chilling and shivering. This also contends the abdominal muscles. Then, for the inspection of the abdomen, first is you need to inspect the abdomen for skin integrity. And then, inspect the abdomen for control and symmetry. Observe the abdominal contour while standing at the client's side when the client is in supine position. Then ask the client to take a deep breath and then hold it. Ma'am, can you inhale? So ma'am, can you inhale deeply and hold it? Then assess the symmetry of control while standing at the foot of the bed. Balik ko na din, balik na ko if detention. Balik na ko if distension. So, if this tension is present, measure the abdominal girth by placing a tape around the abdomen at the level of the umbilicus. Measure. Then, observe the abdominal movement associated with respiration, peristalsis, and aortic pulsation. Then, observe the vascular pattern. So, for the auscultating of the abdomen, of course, you will need your stethoscope. Then, auscultate the abdomen for bowel sounds, vascular sounds, and peritoneal friction rubs. Next. Last. Upper left quadrant. This will determine the presence of tympathy and dullness. So for the percussion of the liver, begin. So in percussion of the liver, begin percussing the abdomen along the right mid-clavicular line, starting below the level of the umbilicus. Then move upward until the percussion note changes from the tympathy to the dullness, usually at a slightly below the costal margin. Then mark the point of changes with a felt tip pen. Then percuss downward along the right mid-clavicular line, starting above the nipple. Then move downward until percussion note change from normal lung resonance to dullness, usually of the 5th to 7th intercostal space. Then again, mark the point of change with a felt tip pen. Then estimate the liver size by measuring the distance between the two marks. This indicate the lower border of the liver and indicate the upper border of the liver. Then for the palpation of the abdomen, perform light palpation first. Systematically explore all the 4 quadrants. Then, now we will perform the deep palpation over all 4 quadrants. This will detect areas of tenderness and muscle guarding. Then moving on, and palpation of the liver. Palpation of the liver, this will detect the enlargement and tenderness. So there are 2 methods. The standard palpation and the hooking the liver. So for the standard palpation, we need to place the patient in the supine position and then stand at the right side of the client. Then place your left arm underneath the client's back at the approximate location of the liver. Then place your right arm slightly below the mark at the liver's upper border that you made during the percussion to find the mark. Then point the fingers of your right hand toward the patient's head just under the costal margin. Then ask the patient to inhale deeply. Ma'am, can you please inhale? Then gently press in and up on the abdomen until the liver brushes under your right hand. Again, ma'am, can you please inhale? Okay. This will note any tenderness. So for the hooking the liver, you need to stand next to the patient's right shoulder facing her feet and place the hand side by side, and hook your fingertips over the right costal margin below the lower mark of the dullness. Then ask the patient to take a deep breath as you push your fingertips in and up. Ma'am, can you please inhale deeply? So, if the liver is palpable, you may feel the edge as it slides down in the abdominal as the patient breathes. So let's move on in palpation of the bladder. You need to palpate the area above the pubic symphysis, and this indicates the possible urinary retention. And then document findings in the client's record. And now, in assessing the musculoskeletal system, this is a evaluation of strength, tone, size, and symmetry of the muscle development, and for presence of the tremors. The main objective is to check any deviation of the musculoskeletal system and to acquire information and accurate nursing history of the muscles, bones, and joints of the client. Then lastly, to be able to formulate nursing diagnosis, collaborative problem, and referral. For the preparation, we need to assemble the goniometer. Then, we need to introduce yourself and verify the client's identity. And then explain to the client what we're going to do, why is it necessary, and how the client can cooperate. Then, perform hand hygiene and observe other appropriate infection control procedure. Then, provide for client's privacy. Then, you need to inquire if the client has any history of muscle pain like onset, location, character, associated phenomena, and aggravating and elevating factors, any limitations of the movement or inability to perform activities of daily living, previous sport injury, and any loss of function without pain. Then, inspecting the muscles, we need to inspect the muscles for size. Compare each muscles on the side of the body to the same muscles on the other side. Then, for any apparent discrepancies, measure the muscles with tape. Then, we need to inspect the muscles for tendons and contractures. Then, for inspecting the muscles for tremor, we need to inspect any tremor of the hand and arm by having the client hold arm out in front of the body. Then, palpate muscle at rest to determine the muscle tonicity. Then, palpate muscles while the client is active and passive for flaccidity, spasticity, and smoothness of the movement. Then, for the chest muscle strength, you need to compare the right side with the left side. And then inspect the skeleton for normal structures and deformities. Then for the bones, you need to palpate to locate any areas of edema or tenderness. Now let's move on and inspecting the joints. So we need to inspect the joints for swelling, then palpate each movement for tenderness, smoothness of movement, swelling, crepitation, and presence of nodules. Then inspect the joints for swelling. Then ask the client to move the selected parts of the body. Ma'am, can you move your fingers? Right. Another side. Then move your fingers. Then, if available, use a ganometer to measure the angle of the joints in degrees. Since I don't have a ganometer, I will just use a ruler instead. I'm going to move your arm. Then, lastly, you need to document findings in the client's record. That will be all. Thank you.